study was to determine whether the prevalence of chronic conditions was higher in neighborhoods with greater deprivation and whether the associations differed by age, sex, race, or ethnicity. My name is Alana Chamberlain, and I'm an associate professor of epidemiology at Mayo Clinic. I'm the first author of the manuscript, Associations of Neighborhood Socioeconomic Disadvantage with Chronic Conditions by Age, Sex, Race, and Ethnicity in a Population-Based Cohort, published in Mayo Clinic Proceedings. We conducted a cross-sectional study that included almost 200,000 people aged 20 years and older from a 7-county region in southern Minnesota. We utilized the Rochester Epidemiology Project, a medical records linkage system, to enumerate the 7-county population and to ascertain the prevalence of 19 chronic conditions for each person in our study. We linked a publicly available measure of neighborhood socioeconomic disadvantage called the Area Deprivation Index at the census block group level. The Area Deprivation Index is a composite measure of neighborhood socioeconomic disadvantage that includes census measures capturing income, education, employment, and housing quality. We observed an increasing risk of most chronic conditions with increasing Area Deprivation Index. Some interactions were observed. In particular, differences by age were observed for most of the chronic conditions, where stronger associations were observed in younger persons, with either attenuation of results or no difference across area deprivation categories in persons aged 70 years and older. One possible explanation of the observed differences across age is a selected survival effect, where the most disadvantaged persons may die younger, compressing the difference in associations across area deprivation index at older ages. In addition, it is possible that as people age, their socioeconomic status has less of an impact on disease burden because age itself becomes a more important risk factor for the development of chronic conditions. In addition, stronger associations were observed in women compared to men for approximately half of the chronic condition studies. Differences were less pronounced by race and ethnicity, although for a few chronic conditions, we found stronger associations in whites and non-Hispanics. However, future research using more racially and ethnically diverse populations is warranted to better understand these associations. Our findings underscore the importance of recognizing the overall and potentially differential impact of area-level deprivation on chronic disease outcomes for diverse populations. In particular, the Area Deprivation Index is a simple measure that can be obtained as long as a person's address is known. The Area Deprivation Index could be used for tailoring patient-centered care, for example, to identify persons who may benefit from community-based care management interventions. I invite you to read our article appearing in the January 2022 issue of Mayo Clinic Proceedings for further details.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.